In this lecture, I will discuss about the ankylosing spondylitis. I am in the playlist of common cases in physical therapy, and this is very important lecture that I will discuss today. Ankylosing spondylitis is a spondyloarthritis of the spine and the pelvic. It's very important to remember it is the spondyloarthritis of the spine and pelvic region. Affected joint progressively become stiff and sensitive due to bony formation at the level of the joint capsule and cartilage. There is a bony formation at the level of joint capsule and cartilage, and there is also joint stiffness. Region more affected by the disease are the axial skeleton and the SI joint, sarcoiliac joint. Axial skeleton mean the framework that is beyond the upper extremity and the lower extremity. Apart from appendicular skeleton, upper and lower extremity, trunk, ribs, sternum, head, all included in the axial skeleton trunk region. It causes a decreased range of motion. There is a decreased range of motion and give the spine an appearance similar to the bamboo. It's also called as bamboo spine. Other joints such as hip, knee, ankle and shoulders and temporomandibular joint TMJ, temporomandibular joint are also affected by the disease, but in the majority of cases back and neck are the most commonly affected. Back and the neck are most commonly affected. In this lecture, I will discuss the ankylosing spondylitis. It is the spondyloarthritis of the spine and pelvic region. There is joint stiffness, bony formation, and there is also bony formation at the level of joint capsule and cartilage. Axial skeleton affected and the sarcoiliac SI joint. There is decreased range of motion. It's also called bamboo spine, and most commonly region affected are back and the neck. This you can see a normal spine, a inflamed. This is the inflammation of the ligament and the joint. Here is the introduction. Next we have treatment. The patient should be given the following exercise instruction in order to increase mobility and correct deformity. So there is range of motion decrease and there is deformity. So to increase range of motion and mobility and to correct the deformity, here are some exercises. Exercise number 1, seated rotation. Begin the exercise sitting straight on a chair, feet flat on the ground and your face facing forward. Number B, place your left arm behind your left buttock and your right hand on your left knee. Rotate your trunk looking over your left shoulder, holding. When you feel a slight stretch but are still comfortable, hold this position for a few seconds. Swap sides and repeat the exercise. You can do seated rotation and go for stretching. Complete 2 turns per side. Please note chair with armrest are helpful for this exercise as it helps you to lever off the armrest as opposed to your thigh. Armchair is best. Second exercise, head turning. Sitting on an exercise ball or chair, slowly turn your head to the right, looking over your right shoulder but keeping your trunk facing forward. This is the stretching position. Place your left hand behind you to stop extra rotation through the spine. Hold for few seconds. You may place your right hand on your front jaw line to help your head turn a little further. Okay, you can give more stretch. Slowly turn your head back to the center and repeat to the other side. Repeat the exercise twice on each side. Exercise number 3, trunk curl and stretch. These are all the stretching exercises. Sitting on exercise ball or chair, start in an upright posture, facing forward with your hands or your knee. Slowly roll down the spine one section at a time, running your hand down the leg until you feel a stretch through the spine. Bending of the trunk. When you achieve the final position, Let your head hang heavy so that it's a dead weight hanging from your shoulder. Hold for the count of 10. These are all the stretches you can perform. Slowly roll your spine back to an upright position, bringing your palm facing forward and feeling a stretch across the chest. Repeat this exercise as you roll back down and reach the bottom. This exercise, exhale a full breath out, rolling back up. When you reach the top, face palm forward and inhale a full breath. Full back stretch. Next exercise number 4, full back stretch. Kneeling on the ground on all fours. Start in a 4-point kneeling position, keeping your hand directly under your shoulders and knees directly under your hips. Breathe out as you sink into a stretch. You can feel stretch. Slowly bring your bottom down towards your heel and your chest towards the floor as far as you comfortably can. Hold the position for a few seconds. Remember to breathe out as you sink into the stretch. Slowly move back into the starting position. Go for a stretch and slowly add at the starting position. Repeat the exercise trying to stretch back a little bit further each time. Go for progression every time. You should feel a good stretch the whole way through the lower back and the shoulder blades. If you would like to increase the stretch, place your hand on one side of your body and then draw your bottom back over the heel on the other side. Repeat on the opposite side. You should feel the stretch between your shoulder and the hip. Exercise number 5, back arch. Lay down flat on your stomach and raise the top half of your body slightly off the floor by propping up your elbows. Sink your spine, chest and shoulder blades down towards the floor, making sure not to overextend the neck. Rather look forward ahead. Hold this for a few seconds. Relax and lower your body back down, returning to a flat position on your stomach. Remain here for a few seconds and then repeat this exercise. These are all the stretching of your spine. Allow your chin to drop down to your chest. This will provide a stretch to the back of your neck and the shoulder. Then look forward and let your chest drop again. To make the exercise little more advanced, bring the hand back level with the armpits, axilla region. Perform the same movement but push up a little bit higher through the arm. Make sure your hips stay in contact with the floor. Remain in this position for a few seconds and relax back to the floor. In this lecture, I will discuss about the ankylosing spondylitis. It's also called bamboo spine. In this, there is a stiffness. Stiffness can go with the help of stretching. So we also see the treatment with the help of stretching. You can also tell me the question. Ankylosing spondylitis, commonly known as. Thank you.